Hi, everybody. Welcome to the inaugural kickoff episode of Care Anywhere, the Global Health Workforce podcast brought to you by CGFNS International. Today, we're laying the foundation and building the framework for the journey around the world we will take on this podcast, focusing on the current state and future needs of our global health workforce. I've invited two guests today from our own organization who can help us set the stage for some powerful conversations to come. You'll meet Peter Preziosi, the CEO and President of CGFNS, and Julia To Dutka, who is Chief of our Global Health Workforce Development Institute. They share their insights on what's happening in care delivery around the world, what's impacting the global shortage of frontline health workers, and as importantly, where there are big gaps in health worker training, credentialing, and career trajectories. We're just touching the tip of the iceberg today, with more to come. But this is the beginning. So don't go anywhere. Episode 1 starts right now. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing. Scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce podcast, brought to you by CGFNS International. Welcome, everybody. We're kicking off episode 1 today. This has been a long time in the making, and we're excited to be hosting these important conversations. I'm joined today by two of my colleagues at CGFNS, our CEO, Peter Preziosi, and the Chief of our Global Health Workforce Development Institute, Julia To Dutka. Hello, you two. Welcome to the podcast.
Hi, Leah.
Hi. It's great to have you both here. So this is our launching podcast. What we really want to do today is frame out the discussions we're going to be having over the next few months and hopefully years as we push this podcast out. Over the podcast, we're really going to cover a lot of ground around workforce development, and I'm looking forward to having some great discussions with key stakeholders in our industry and having you both back on from time to time, hopefully, on the podcast. So we can focus on big picture issues around global workforce development for healthcare. CGFNS sits in a very unique position, I would say, in this space, which we'll talk a lot about today. We're at the intersection of education and training for this workforce and for workforce development, credentialing, and care delivery. So I do think that positions us very well to host discussions like these. So let's start with telling our audience who we are, if they're not familiar with us, why we're hosting these conversations and this podcast and inviting people to sit down at the table to join us. So Peter, when you're out traveling on behalf of the organization, which you do quite a bit of, and people ask you who CGFNS is, or maybe even a family member who doesn't know how much about the work you do, and people say, what is CGFNS or who is CGFNS? What do you guys do? Why does it matter to global healthcare? How would you frame out who we are and what we do at the core of our service delivery?
I would say that we are a global health workforce solutions company with deep expertise in assessment, evaluation. We've done global certification since 1977. And we have a real opportunity here to lift up the health workforce all around the world to better prepare them for the major challenges that we have as the population is shifting dramatically.
Wonderful. Julia, jump in with your thoughts because you've been with the organization a long time. You've got so much experience in this space, and you're really helping us as an organization go through some significant strategic and operational transformation right now. What are your thoughts on who CGFNS is and how we connect to this ecosystem of care delivery and workforce development?
Well, thank you, Leah. This is what I see. We have the opportunity and the responsibility to focus on our strength in assessment and certification during this very challenging time. It's not only about growing the health workforce, but to be able to meet the special needs that we are seeing all over the place. CGFNS is approaching its 50th anniversary very soon. And it is important that we apply our core strengths to create new solutions to meet health workforce challenges, not only anywhere, but everywhere. In this past year, we created our Global Health Workforce Development Institute precisely for the purpose of addressing global health workforce issues. The Institute would serve as a workplace for the global community to come together to wrestle with these very complex issues that we are facing and to evolve creative but practical solutions.
I just wanted to say that, healthcare is all about people. First, it's about the people that use the service, and then it's about the people that are providing those services. And if we're not focused on that, how are we going to evolve care delivery that's needed and is changing rapidly because of technology, artificial intelligence, generative AI? We're seeing telehealth solutions that are cropping up all over the world. But we have to really think about it from the perspective of our people, whether it's dealing with people that are presenting themselves and dealing with them in a proper way, because right now I think we've over medicalized birthing, we've over medicalized end of life care, and the way we look at the workplace and how we're dealing with our health workforce that we're employing in the workplace to enable them to work at the top of their capability and to create greater efficiencies.
So a lot of people would say, why is a verification, assessment, and certification company hosting a podcast like this? What makes us a good candidate for convening people and pulling people to the table? And I do think it really goes back to the position we sit at in industry. It's a simple but powerful answer. As a gateway for health workers who are seeking career mobility, we're connected to a big ecosystem, regulators, other NGOs, institutes of higher learning, workforce recruiters, credentialing bodies, ministries of health, people you and Julia spend a lot of time talking to. So that network of people who are all connected to these issues, to creating standards, to solving big problems and challenges, addressing disparities across the globe where workforce development is concerned, being at the epicenter of that makes us a good convener, I think, for inviting people to sit down with us here. And I'm looking forward to those conversations down the road. So let's talk a little bit about timing, because the timing of this is really important, not only for the direction that we're growing as an organization, but really where we are in global healthcare right now. Peter, you touched on this just briefly before when you were speaking. You were starting to kind of go down that list of, this is a critical time in healthcare. In healthcare delivery globally, we're at some critical junctures. I think we're all used to hearing about critical shortage. I've heard that a lot, where workforce is concerned, and nurses specifically. We sometimes get very narrowly focused on that being a domestic issue, but it's really a global issue. Not only the challenges of shortage, but what behind that, the big gaps in career opportunity, career advancement, credentialing, et cetera. But before we dive into workforce specifically, I think it would be good to describe the landscape of global healthcare right now in general. So, Peter, what are some of the big economic, geopolitical, demographic shifts that we're seeing internationally, or that you're hearing when you're traveling? What opportunities and transformations are reshaping the way care is being delivered and being conceptualized from a delivery system perspective that's going to have an impact on workforce? Thoughts on that?
Sure. Yeah. First, from a macro perspective, there's a great deal of uncertainty geopolitically. We're seeing, many, many changes, different alliances, different world powers that are shifting, and the economies around the globe in a post-pandemic environment have created a great deal of uncertainty for quite a long time. And I think we're still trying to come back around supply chain, which has been a really big challenge. So I think that first, we're looking at what's happening around the world globally. as it relates to where people live and work. Number one, climate change. Big challenge right now. And what you're seeing as a result of climate change are people becoming displaced, people having to live in hotter temperatures. There's flood. There's a higher degree of typhoons and hurricanes. There's a variety of things that are really impacting the land. And it's not only impacting people, but it's also impacting animals. And what we're seeing is more and more people and animals are moving closer together so that disease transmission can occur more commonly. So I think that's one thing. And, we're all seeing a lot more disruption with war and conflict. Look what's happening in the Middle East. Look what's happening with Ukraine and Russia. You had Syria, Afghanistan. We can just go on and on on the continent of Africa. What's happening with some of the destabilization that's occurring in South America. And as a result of that, you're seeing more governments putting money into defense spending and taking that money away from health, education, and social welfare programs. So that impedes the acceleration that is necessary to improve health delivery around the world, particularly in primary care and public health.
Yeah, we obviously see a lot in the news about these geopolitical events, the war climate, the impact of devastating, catastrophic events on families and communities, but we're probably not hearing enough outside of healthcare circles about the resource constraints in those areas to actually care for people when those events happen. Humanitarian aid is sent in, of course, but you don't see on the news the aftermath of people who need long-term care from these kind of events and just how resource constrained those areas of the world, already are. They don't have the pipeline really in place for skilled and licensed or credentialed workers who can step up and fill these roles when these kind of events happen, whether it's a natural disaster or catastrophic events of war, like you mentioned, Peter. And it's not like we're seeing a decrease, sadly, in those kind of events. I think you're right. Between climate change and the war climate, there's a whole lot of people who need care. We're not really even scratching the surface on regional resource limitations because these events aren't happening. This is what we don't talk about. They're not happening in areas of the world where they already have an abundance of care resources and, in advanced health systems that can support that kind of catastrophic overload. These events tend to happen and impact underserved, low access areas of the world. Which is a conundrum. Julia, your thoughts on what's going on globally with healthcare, what you're seeing when you're out there traveling or hearing from those folks that you talk to?
Well, I think that for the first time, I'm beginning to see that countries are beginning to be willing to open up a little bit more than before. Conversations such as global collaboration and people coming to the table together to try to explore some of these issues of mutual concern, that was uncommon for the longest time. In the past, I think it was very common for us to see what we call side-by-side conversation, in which people talk about what's happening in their own country, as if that is already global exchange. And I think that for us to really have a genuine commitment to be willing to open ourselves up and have conversations that really cross borders and cross cultures and cross level of income to address some of the very fundamental issues that affect people's health. That is very important. And I think that I'm beginning to see that there is an opportunity to work towards that goal.
That's really interesting, Julia, because to me, that's the difference between sharing and collaborating. There was probably a time when people would share what was happening in their countries, maybe at a conference or a summit, but they weren't necessarily collaborating across borders to solve regional and global issues. But the old saying, necessity is the mother of invention. It's probably the mother of collaboration as well. And certainly the pandemic was a paradigm shifter in that regard. We're just seeing a tremendous need for people to move beyond sharing and really into global collaboration. So it's really a great time for us to be having these conversations right now. Given all of those factors, I think it's a global imperative, we would agree, and hopefully we can see global authorities recognize that addressing workforce development is a global issue. It's not siloed in one space or the problem of one nation. I think a lot of people want to stop with shortage, but that's not the only thing that's impacting workforce development, as we talked about a little bit on the front end. It has a lot to do with some of these other factors, which I would love to talk about, complex and multifactorial issues. So, Peter, when you talk to ministries of health and regulators and health system leaders around the world, how are they addressing their workforce challenges right now? I'm sure there's a focus on shortage. That's a given, but it goes so much deeper and wider than that, as we know. Where are they really struggling, and how are they addressing the gap between the number of people who need care in their countries, especially the underserved, and the number of skilled workers that are actually available to meet that need? What are you hearing on that end?
Yeah, I would say that the biggest challenge is to get our arms around, if you will, this issue of shortage. I know when Julia and I have gone out and spoken to a number of people, we look at it from the perspective of insufficiency, meaning we may have an ample number of people, but they're not necessarily being deployed properly, and we don't know if their skills and competence match the needs of the population that they're caring for. So it's this issue around insufficiency, which is getting back to the question that you raised before about why us, and why are we an important player in the scheme of it all. I mean, there are a lot of important players out there, and I also have to say I completely agree with Julia about there's a real willingness now to collaborate, and it's an exciting time to be in healthcare globally because of the willingness to collaborate and to build capacity around the world. So assessment and evaluation is one area. We're also talking about recognition. How do you recognize excellence around the world? How do you evaluate that from a standard standpoint? But this insufficiency is something that I think that ministries of health and labor are struggling with for a variety of reasons. A big area is lack of resources, where there is not enough formal training and even informal training around lifelong learning and continuing professional development to help the workforce evolve into new areas that they're going to have to be capable of tackling because of the changes with medical discovery, personalized medicine, all the things that are happening. So that's how I think that that's what they're really struggling with, and and they're looking for these quick fixes.
So it's really an infrastructure issue, right?
Yeah,
I mean, that's what we're talking about, infrastructure. To me, it comes down to significant gaps in frameworks and standards. And we can talk about that, and we'll talk about that over the podcast, I'm sure, many times. And for our audience who's watching and listening, they may not be familiar. And I know I wasn't until I came to CGFNS, really about how much disparity exists in standards of practice between one country and another, and even between one health occupation and another. And again, going back to what you said earlier, Julia, about people operating in silos, these folks were developing, they were meeting their care needs and their training needs within their nations in a siloed way, and unfortunately not collaborating with other nations and health systems to create global frameworks and standards. Probably not fair to say there were no efforts, but certainly not to the degree that's needed. So on the plus side, there's tremendous opportunity to do that. And Julia, you're seeing this right now in the area of rehabilitation care, which I'd love for you to talk about for a minute. There's a huge need for care workers in this area, much bigger than I realized, certainly, but an even greater need for qualified workforce with verifiable skills to take care of those folks who need care, because that'll be critical to building capacity to meet that global need. So can you talk about that for a minute, what you're seeing in rehab care?
Yeah. This is what I'm seeing, Leah. I'm seeing 2.4 billion people needing rehab care and yet not being able to find them. I'm seeing a country with 118 million people with four, I'm saying four, occupational therapists.
Can we just pause on that for just a second, Julia? Not to interrupt you, but that really does go back to what Peter was saying about those core challenges of climate change and the impact of war. Long-term rehab care is often directly tied to those events and is so stitched to what you're talking about right now. Like, I was blown away by that number when I first heard it, that 8 billion people in the world, of 8 billion people in the world, 2.4 billion of them need rehab care. Many of them require multiple therapists. And there are some countries where you have therapists in the single digits. It's mind-blowing to me, really staggering. Important number.
Well, look at the islands. We have thousands of islands just in the Pacific Ocean alone.
Right.
And there are all these people living on the islands. They are visited by a therapist, one therapist, once a month for a day, only a day. So think about that in terms of what we are talking about. Many of the countries are struggling and working with existing models of care and say, let's do more. The question that I have is that, is it enough to do more of the same thing?
Okay.
Because those approaches are not scalable. So you try to fix one issue here, another issue prop up somewhere else. So what I'm saying is that fundamentally there needs to be an opening up to allow us to look at alternative models, alternative approaches, a different way of thinking. And those things cannot be readily accommodated in current structures or educational models, because in order to produce occupational therapists, you need to have professors to be able to teach them, right?
Mm-hmm.
And then where do you find all those people? And then they have to be at a level higher than the people that they are preparing them to become. So where do you find all these higher level people to be able to do the work? Whereas on the other hand, on a daily basis, these people have to deploy their skills to be able to serve the public that are coming into the doors because they need all this help. So somehow or another, I think that that is where I really see a very sweet spot in terms of the concept of global certification.
Right.
It is not that we're negating the importance of academic education, but there are many circumstances under which that relying on academic models would not be fast enough, sufficient enough to be able to meet the overwhelming care that is out there. I think Peter wants to jump in.
I completely agree, Julia. And I think what we're seeing, health systems, employers are demanding things differently now. Less about degrees, more about competence and skills. And it could be an interdisciplinary solutions that are going to have to solve these problems. Secondly, I think as consumers become much more knowledgeable, much more engaged because of the information that's on the internet. And I know that we think about that only from a high resource country, but the internet's ubiquitous for the most part. Even in very low resource countries, people, have cell phones. And we saw that, Leah, at Verizon. when we were looking at solutions to support the reduction of non-communicable diseases like diabetes and cardiac disease. So I think that with consumers driving more and having greater expectation and demanding better, and employers having different expectations, I think it's going to turn a lot of the healthcare system upside down because of need.
Well, we're already seeing significant shifts in scope of practice and a flattening to some degree of the traditional top down, physician centric leadership infrastructure that I think has been prevalent in healthcare. And we're also seeing vastly different career paths for nurses than we would have seen 15 or 20 years ago. In fact, we're going to be having some really great nurses on this podcast who are sitting today in leadership roles, executive decision making, and influencing roles in big tech companies that are developing technologies to transform care delivery. And truly, it's a great time to be a nurse, to step into healthcare despite discussions of shortage and burnout. And become part of that evolution and opportunity. I want to talk about, as we pivot, one of the reasons that we developed this podcast is to talk about this subject of care anywhere. As an organization, we're very focused on career mobility. So let's double click on that for a minute. I'd love your thoughts, both of you, on what you think of when you think of career mobility. It can mean a lot of different things, obviously, from physically moving your career from one location to another, or the upward trajectory of a career in terms of career advancement. Peter, let's start with you. When you're out there talking about career mobility and we're building that cadence in the marketplace around that message, how do you explain it? How do you contextualize that for our stakeholder groups?
So I think it's an all-encompassing. I think you captured it, Leah, where it's looking at enabling that workforce to be more mobile. You know, we've talked about creating a global cadre of health workers at every level. And then how do you create some type of a lattice, if you will, that enables that individual to move in and out of different types of titles and careers and professions within in healthcare, you know, going from health informatics to administration over to clinical and all of that, because there are undergirding principles for all of those fields in healthcare. So I think that, to me, is when I think about career mobility, I look at it from a developmental perspective as well as a logistical perspective of moving around geographically, whether within your local community, your region, your country, the region of the world, and globally.
Julia, your thoughts on that?
Well, I think that when we look at the concept of mobility, one of the very key thoughts that came into my mind is the idea of ending silos. And I think that that's really is the key. Because what it is that if you look at the way that we look at the concept of a care team, which does not exist in many regions of the world because of the hierarchical structure of relationship between and among different professions. So they may understand it in terms of the idea, but in practice, it's not there. We have a problem. When you look at professions and how people are being trained and prepare for their respective professions, they might be introduced to the idea of interdisciplinary nature of their work or interprofessional relationship. But in actuality, that is more like an ideal rather than a reality. So unless we can move in those directions, that will lead us to breaking down some of this kind of very rigid boundaries, we're not going to get anywhere because of the fact that we can't even learn between and among ourselves as to how to work better. how can we expect that the care that we give to people to be improved? And I think that that is precisely a space that CGFNS is very good at. It's the concept of mobility.
So how do you begin? Because I think, Julia, this might be a great place for you to jump in and talk about how you did this for the rehab certification exam. For those that are listening, CGFNS has just launched a global certification exam for rehabilitation nurses. And it's the first one globally that's been put out to assess knowledge and skills in this specialty area for the global nurse workforce. But it took a lot of work over many years, Julia, for you to pull all the right people together from across nations and borders, like we talked about earlier, to figure out what that competency framework should really look like. So how do you do that? How does that start? Because to me, that's something that then needs to be replicated across a lot of other specialty skill sets like mental health, like tech literacy and telehealth, and so many other things that we've been talking about, to give these nurses and health workers credentials in their toolkit to validate that they have the unique skills to support evolving care delivery models. So can you talk about that labor of love and how you did that?
This is really taking me down memory lane. It has been many years. But what is so gratifying is that we now have a model upon which we can use and apply it to other high needs areas in which that the professions and those involved in care delivery can benefit from this kind of opportunity to explore some very specific issues together. So let me tell you a little bit about what I did. So it was 2019, and we were approached by CAF International and say that, well, we really need you to help us to develop a global certification type mechanism to be able to validate the knowledge and skills of rehab nurses in the facilities in which that we accredit these programs. So we came together, and then there is really no blueprint or roadmap for that kind of work because it was never done before. So we have people from several countries, United States, Canada, the UK, Ireland, Australia, Portugal, China, Sweden, Norway. So I might have left out one or two countries. And then we met as a group and say that, what do we do about this? And then we start talking about what are the competencies that we expect of nurses who are good rehab nurses. Because don't forget, Lea, when you come to think about it, people call themselves rehab nurses. Sometimes it just means that they are working with rehab patients. It doesn't mean that they have had the formal education or the training or the certification to have validated their knowledge and skills. So we started with that, and then we put all the domains and attributes and expected outcomes in terms of what they can do. Our premise was, I should say, because it was 2019, what they could do when they're being classified and described as a rehab nurse. And we started from there, and then we put the framework together upon which we created the test blueprint. And then we sent it out to a lot of people in the world and then asked them to validate it. And then we went through several levels of that kind of iterative process. And then we created the test blueprint. And then we recruited additional people to write the items. And then we recruited even more people to do the review of the items that we have written.
That's really amazing. So, okay, appreciate all of that. Thank you, Julia. Guys, we're out of time. We've run to the end of our time. We need to wrap up. I think we could go on a whole lot longer. We may have to have a part 2 together. And I know you guys will be back on the podcast for future episodes to dive in more on career mobility and credentials. We're going to be sitting down with thought leaders and experts in the future on a wide range of topics. So much we're going to be exploring around nursing careers and health worker careers, career advancement, nursing-led care models, career pathways, emerging technologies like telehealth and artificial intelligence and machine learning. We'll definitely still talk about nurse migration and the global movement of workers around the globe and all of the impactors and trends around those issues. We'll talk to experts about how critical fraud detection and prevention is when it comes to making sure the credentials that health workers earn around the globe cannot be stolen or misrepresented. A lot of work goes into those credentials, preparing for them and earning them. So that data security is really critical. We'll touch on those issues in future episodes, and we'll also be discussing ethical recruitment and the very real problem of human labor trafficking, which we didn't touch on today, but we'll definitely be talking about moving forward. We appreciate everyone listening, and I want to thank my 2 guests, my colleagues and friends, Peter and Julia, for joining me today to get this podcast kicked off right.
Take care.
Come back
Bye.
some more, guys. We're going to be talking about these issues in future episodes. Thank you for joining us. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at cgfns.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.